Hey everyone, in this video we're going to be talking about the best business models for a physical therapy clinic. So if you're thinking about becoming a physical therapist or opening a clinic, we're going to talk about some things that you should be aware of and what I personally think the best model is and what we do here at Iron Health. We'll talk a little bit about that. So in my experience, there really is 3 types of clinics out there that I have seen. There's a mill type clinic. When we say a mill, it's literally they just turn and burn them. There's 5 tables and every one of those tables is full at every single moment and it's just shifting. So you're on to one person, to the next, to the next, to the next. This also happens in hospital outpatients as well. So these mill type clinics are really, for the most part, not owned by a small business or an individual. They're owned by a big practice or they gotten bought out by a bigger practice. So that's a mill. The second one is you have the one-to-one type of clinics. These are more niche clinics. They're more a higher end type clinic where people either have to pay out of pocket or they have to have really good insurance. So in these types of clinics, you're gonna see one patient to one therapist, anywhere between 30 minutes to an hour. Now, these are a lot better on your hands if you're a PT, and it's also a lot better for your clients because you can deliver a quality type of experience. This is just my thoughts. I could be wrong. Someone else might disagree, but that's okay. So a couple things that I want to point out. In these one-to-one clinics, you're not going to be able to take every insurance. That's just the way it is. And there's two things to talk about. You have in-network and out-of-network. I'm not going to dive into the specifics of what insurance is. That's a whole lecture on its own. But in-network pretty much means your provider, your PT, has a contract with every insurance company and they get paid X amount based on the insurance company's demands. So the PT doesn't get to pick what they want to charge. They don't get to pick what they're able to collect. So a lot of times what you see is the reimbursement rate gets lower. And that is the reason why they have to be these mill clinics. So those in-network clinics traditionally tend to be the mill clinics that actually have a viable business, right? So then you have out-of-network, which means that your provider doesn't participate with any of the insurance companies and there is no specific contract. So the rates might be a little higher. You may be liable for a little more of the expenses, but it's better quality and you're gonna potentially get private physical therapy is really the key there. And I would say the other model too, and another point I wanted to bring up was cash pay. Now, for cash pay PT, it's literally, you're seeing a lot of this come out where physical therapists are just going to their own practice and they are charging a cash rate to everyone and they're getting clients and it's a good business. But I would say there's pros and cons to that. With cash pay, you are limiting the amount of people you can serve. You are taking away the responsibility as a healthcare practitioner, or the ability, I would say, to bill insurance. As being a healthcare practitioner, we have that ability to bill insurance. We should try to use that if we can, in my eyes, right? So that does have pros and cons. Even with a cash pay or out-of-network model, the biggest pro is you're not dictated by the insurance to what your treatment can cost, what it should cost, and what you're gonna make on it, honestly. So you have these 2 big models, and I would really say the best model right now to go into is go to one that's a mix. You wanna make sure you're helping people. Let's say for Medicare, for example, someone who's the baby boomer generation, you wanna take Medicare, you wanna help the older population. This is my experience. Again, this is just my experience, this is what I believe. So you help with Medicare, you're out of network with most insurances. They do not dictate your care or your self-pay. I personally think that's the best model for a physical therapy clinic. It allows you to give one-on-one care and attention, give a better experience, and really just help people that really want to be helped. So that's my top thing for what kind of model you want to be in. You also want to make sure if you're going to be in a physical therapy clinic like that, you have the ability to have auxiliary services because they go hand in hand. So those types of clinics are popping up. We're kind of doing that here in Iron Health, where it's more of a health clinic rather than just PT. So that's, I think, is the best model for any physical therapy clinic. If you have specific questions, please feel free to answer me. If you are more into the mill clinics, that's okay too. Just don't answer me. Thanks for watching. Thanks.